So friends, we're going to have 10 minutes of question and answer, and then we're going to call X up and Marcia Tilton, and that way we'll respect your time, and of course when we're done, there'll be plenty of time for you to converge on each of these people separately and divide or conquer. How does that sound? All right? So, does anybody have a question? Tom does. Now, be sure to say who you're directing your question to, if you would. If you have anybody.
Yes. I think her name was Kelsey.
Okay.
Yes. Yes. And so with this Uber Trust, are those grants that are going to be awarded to cities, or is it financing for projects?
So it could be both. So with money, one of the things that we do have in legislation is specific language that says that we have to adhere, if it's state funding, to the guidelines of that state funding. So the example I'll use is Mental Health Service Act dollars. Those come with very specific guidelines about who they can serve, who they can't serve, what the qualifications are. So just because either the county decided to allocate some of those Mental Health Service Act dollars to the trust, or because we did a fancy budget authorization or whatever, doesn't mean that we now get to use it however we want. So if that funding force says this is a grant, we would use it as a grant. So on the philanthropic side, which is usually where I get this question from, is this money that Angels or some other big corporation is giving, if they give it in the form of a grant, it would be given out in the form of a grant. There is some conversation amongst some very wealthy kind of folks that have been involved in this conversation. Bill Taormina, I don't know if you all have heard of him, he's been very involved in this from the kind of northern service planning area perspective. And what he's been talking about is getting together what he calls 50 legacy families that would each give $2 million to raise $100 million in capital. And in those conversations, it's been both the form of philanthropic giving and what are called social impact bonds, so extremely, extremely low interest bonds. But that would be something that we would kind of have to figure out as that flow comes in. But in all cases, we would adhere to the guidelines of the funding source.
Thank you. Any of the rest of you care to address that question? All right. Is there another question?
Hi, my name is Robin. I have a question. I think it was Julie, you said that the idea for the permanent supportive housing is for 2,700 homeless people, and I think we saw a number of almost 4,700 homeless people. So is there a plan for emergency shelters for the other half of the homeless people that won't necessarily be served by any of these plans?
Thank you.
So certainly on the homeless services side, and the Director of Care Coordination at the county has put together a couple of things. One is we've already developed some emergency shelters, the Bridges at Kramer Place and the Courtyard Emergency Shelter. And then there's the new infusion of money coming down from the state in the HEAP and the SB2 funding. And right now, all of that planning is going on. We have, it's called the Continuum of Care Homeless. And so that Continuum of Care board for that funding is going to be the priority makers. They're going to look at that funding, and the recommendations will come out of there. That money can be used for emergency shelter development. So there will be funding there for that. So there is a plan on that other side. Of the 4,700, the other not 2,700 are actually individuals who were sheltered on the negative count. So they were already in shelters to begin with when they were counted. So there's 2,700 unsheltered, and that's why we focus on that. So there is some, we call it right sizing a lot. But what's going to be very important, and I'd be extremely remiss not to bring this up, is the 2019 count. I'm sure that St. Mark's, your pastor here, and several churches have been phenomenally supportive of bringing volunteers out. We are going to endeavor to count every square mile of the county this time and not use an extrapolation. What that will take is local collaboration, and cities will be calling on a lot of you to volunteer to do that within your city, so that we can get an accurate count. Those demographics will lead us to some of that planning. Do we need emergency shelters for all single males? Do we have, you know, an issue somewhere? It will better help us build out the system. By all accounts, we think the number will go up. I don't see anybody going, no. It'll probably go up, and it'll be part of that planning. So more to come. I'm sure that you guys will be involved in that. But yes, they're building out shelter. And the other, we call them interventions that we need. Some of that is individuals that we do not want to go in the system. They can receive a light touch. They just have completely, for the first time ever, lost their jobs. We don't want to put them, you know, if they only need to have 2 months of rent to become stabilized, that is the cheapest homeless intervention that we can have. So there's a lot of things that we're looking at. Sorry, that was very long-winded.
Is there anybody else who would care to address that question? All right, next question.
Hi, so I'm Mike Arnott, and MHSA money is not necessarily free money. It's not money that comes without a price, especially in terms of human terms. And No Place Like Home, the conditions for No Place Like Home and the $70.5 million that was passed by the Board of Supervisors last year for direct MHSA funding came about because we as a community were not spending the money, as well as communities around the state, for mental health services. So if you have that 70.5 and then you add on top of it the No Place Like Home money, and we put it in the county's bank account and it's there and it's sitting and it's earning interest, and if the cities do not approve these projects, that's money that could have gone to services that will not. And so this comes with an awesome responsibility to ensure that these projects actually happen. So I'd just like to hear from the panelists what's going to happen to ensure the money just doesn't sit there in the bank and go where it really, really is needed.
Thank you. Who would like to answer and solve that riddle?
I'm going to take the back half, and then I'm going to point to my friend at the end and make him talk to you. So what I would say on the back half of your question, you absolutely nailed it. Yes, there's a county role in making those dollars available, and that's something that obviously we should care about. But the county, in most cases, does not have land use authority in the cities. It is your individual city councils that have to approve these projects. What I will say is one of the issues that comes up with homelessness, especially chronic homelessness, is I like to think of it as like a three-legged stool. The first is, the financing. The second is actually finding the land to do this. And then the third stool is, the third leg of that stool is the political will to actually approve these projects. So what I will say is I don't want to put too much on the cities. I want to put some there, but I have been to these city council meetings and it is rough for the folks that are sitting on that dais. So as much as you can talk to your neighbors about what this is and what it isn't and why it's good for your communities, because it really is a community asset, that creates a lot of wiggle room for your councils. How many of you have ever heard of like the Nextdoor app? Any of you? Okay, cool, a lot of you. So you know that can be a very vile place on the internet. So I'm not saying that you should get on your phones at work and troll people all day, but as much as you can try to counteract some of the negativity and the misinformation around what permanent supportive housing is and why it's important to house homeless individuals, the more coverage you can give your councils. My favorite thing to do is I live in Irvine and I run past a permanent supportive housing site in Irvine out in Portola Springs. Yes, Irvine has homeless people, and yes, we have some homelessness housing. And my favorite thing to do is to walk by it because it's right across from $800,000 single family homes. And my friends that come out for a walk or run with me literally cannot tell the difference. And that is a huge kind of perception change for folks to realize, oh, this does blend into my community seamlessly.
Thank you. That's a great question. I think the way I would also approach it is that let's not think about the Mental Health Services Act money and the money that's available for housing for mentally ill as the only option. I think there's a broader spectrum of the conversation that we should be engaged in, which is affordability, affordable housing at all income levels, and assuring that these funding sources that are available are being utilized. And as it was demonstrated earlier by some of the slides, the amount of different capital stacks that are needed for these developments are probably going to make it likely that these are integrated developments that have folks who are just regular working families who are trying to figure out how to live in our county, along with folks who need that extra support. But I would also say that let's take a moment to educate ourselves and educate our partners about the opportunities that we have in front of us. We do have wonderful providers and experts in this area, a lot of nonprofit affordable housing and some for-profit affordable housing developers that are the best in the state and in the nation are located here in Orange County. So let's take advantage of that opportunity to engage them. And there has to be some accountability at the end of it for all of us in the county, right? Every city and the county have to do their part. There has to be political will. Us as residents, we have to also be part of the conversation and accept that we need to figure out a way to house our working families and those with special needs.
All right, thank you.